Our next section is on the Conrad Prebys Center for Chemical Genomics. You can actually see it in the background of my photo. I'd like to introduce Dr. Michael Jackson, who is the Senior Vice President of the CPCCG, as well as the Program Director for Cancer and Molecular Therapeutics and the Associate Director for Translational Initiatives. Michael, I'll turn it over to you.
All right, well, next slide, please. So, so as being mentioned multiple times, the Conrad Prebys Center for Chemical Genomics is a bit of a mouthful, but it's really just the Drug Discovery Center. It's an academic drug discovery center sort of embedded within Sanford Burnham Prebys, in which our ambitions to translate from the fundamental science and the findings in the labs about the molecular basis of disease. So we go to the next slide, sort of shows you sort of how we fit in sort of side by side with the scientific programs and the shared resources and the graduate school. And we are a group of about 60 people. You go to the next slide, and our goal really is to translate the fundamental research into drugs. And we're very fortunate to have the capabilities, as Craig mentioned, to be able to begin that process. And in fact, more than just begin it, go all the way from the concept of this is the molecular target I would like to drug, and then through a series of steps and stages as shown on the next slide, which sort of begin with identifying the molecular target, which is something that's done typically in one of the laboratories using very typically one of the shared resource cores like functional genomics to identify a molecular target. And then downstream of that, do the activities that are very traditionally done, more typically in a pharmaceutical company, in which we develop a molecular assay and then conduct massively parallel screening using robotics of hundreds of thousands of chemicals to find the first beginnings of a drug, which we call a hit, and then move that compound along through medicinal chemistry and pharmacology to improve its potency, selectivity, and drug-like properties until you've got something that's a molecule that starts to be suitable to move into in vivo studies to then evaluate its potency and efficacy in a model of disease. From there on in, we will look to move molecules beyond that through preclinical IND enabling studies all the way through to the clinic. Now, typically, our strength in this process is more in the early stages, getting all the way to molecules that will do proof of concept in animals. And then we typically look to partner those projects with a pharmaceutical company. So many of the people involved in this process, who were on the previous slide, there's about 60 of us in the center. Most of the senior management of that, or senior members of the center, have come from industry. Myself, for example, I worked for 15 years for Johnson & Johnson, or Janssen, just down the road. And so we are able to pretty much and have a lot of experience in this process and really provide a training environment for those who want to learn the tools and technologies of the trade. Obviously, being surrounded by many companies around here, many postdocs will look to involve in their project some period of time where they can get exposed to this. And so if we look at sort of the things that you can look to be trained on, it's not only just sort of assay development, but really starting to miniaturize experiments. You go to the next slide, such that you can start to interface with all of these various machines. And most of the assays conducted will be conducted in a high density format, 384 or 1536 well plates. You can see a number of different robots here. The center has been completely revamped in the last 2 years with the latest and greatest technologies, including more chemistry-oriented approaches to do virtual docking. Obviously, has been a big insurgence right now in chemistry. So we have about 15 medicinal chemists as part of the team, and people will spend time working with them and also working in the virtual world. So if you go to the next slide, on the chemistry side, it's not just making compounds, but doing it at analytical chemistry, computational chemistry. In fact, it's the next slide, computational chemistry, that's really sort of coming of age, where we've increasing number of tools and technologies that we're training people on of how to use the various AI and machine learning approaches to improve our capabilities as an integrative process to not only give ideas on what to make, but also to predict properties of the molecules we make to try and improve that process fundamentally. So hopefully that gives you a bit of an overview of what goes on in the center. People can get trained in many of the elements of this. And obviously that training, if you are looking for a future job in the pharmaceutical industry or the biotechnology industry, exposure to these capabilities and understanding of the process and the machinery and the technologies will put you ahead of the pack, I would say, and will really help in your career trajectory in doing that. I think that was my last slide. Oh no, just to say that, and I think Craig mentioned this, one of the things that is increasingly being interwoven into this is the structural basis of how compounds bind to our target, and then utilizing that information to do computer-assisted drug design and development to really improve and enhance the process. And this is a good example of where we're utilizing core capabilities in the shared resources that overlap with the drug discovery process. It's not just cryo-EM, proteomics, genomics, and all of these capabilities, particularly the functional genomics, finding us new targets, all come together to give us a really powerful package of capabilities to develop first-in-class new drugs against targets that no one else has gone after before. So that's an exciting area, and hopefully some of you will be encouraged into that space, because we need to discover more drugs. I'm just biased, but anyway, that was my last slide. So anyone had any questions?
If you have any questions, feel free to enter them into the chat or raise your Zoom hand. If not, thank you, Dr. Jackson.